Okay, this is the third video for today on chronic pelvic pain. This is a different type of pelvic pain that women experience, particularly in their second and third pregnancies. And it's generally badly understood and badly managed. It's frequently called SPD, which is short for symphysis pubis dysfunction, but it's very little to do with this joint at the front of your bony pelvis. It's much more to do with your soft tissues. What happens is that women present with pain during their second pregnancy, usually from about 16 to 20 weeks. And their first child is at least 4 years of age. And when they describe what happened in their first pregnancy, it's a very familiar story of a very difficult labor with great difficulties at different stages and causing significant internal injuries to a woman, which become manifest in a second and third pregnancy. The anatomy looks like this. This is a cross-section of a woman's pelvis. This is the bony pelvis at the front, symphysis pubis, the joint between the two pubic bones. This is some ligaments in front, and then at the urethra. This is the vagina. This is the rectum, and this is the pelvic floor. This is when you squeeze the pelvic floor muscle. If it's intact, then you can interrupt your stream of urine. Now, what happens one of the injuries that happens during a difficult first labor is that you tear this muscle, the obturator internus, this one along here, off the side wall. So this is the levator ani here, and that's torn off, this underlying obturator internus. Of itself, that might bring tears to your eyes and some pain, but what's more significant is within this area, the main nerves to your pelvis are located. If you look at it in macroscopic pictures, here's the urethra, the vagina, and the rectum down here. Here's that muscle, the one part of the levator ani, here's the other, and this is this other big muscle covering the side wall. This bit is the telltale bit that you can see on an MRI, which is pulled off, and all the pelvic nerves stream down medial to that. So if that bit's injured, then the nerves are often injured as well, and cause this considerable difficulty in subsequent pregnancies. Now, what happens is when the nerve bundles are torn, then they grow back in a very chaotic and difficult fashion. These are all different abnormal nerves, all expressing new stretch and pain receptors, same after some forms of surgery, same after straining on the toilet, but we're dealing usually with a difficult first labor when these women come back in their second and third pregnancies with this terrible neuropathic pain. And what happens is that the new pregnancy is sitting on these injured nerves, and when it gets to an appropriate size, at about 16 to 20 weeks, the woman can present with this terrible pain and often nausea, being sick, all sorts of problems in the pregnancy, which are labeled as SPD. In other words, we're not quite sure what the matter is, but we'll give you some painkillers and off you go. Now, what it is, as I say, the consequence of the previous injury. It's an autonomic injury to the autonomic nervous system. That runs down from your brain up here, midbrain, and there's a cardiac plexus behind your heart, a celiac plexus behind your pancreas, and two pelvic plexi down here. And it's these nerves that get injured in your first labor, which create this raw area, which becomes very sensitive, at least starts at about 4 years later. Then when you have the subsequent pregnancy, the pregnancy lies on these injured nerves and causes this terrible pain, which may, instead of being called symphysis pubis dysfunction, might best be called antenatal allodynia. This shows these autonomic nerves in the pelvis. This is where they get injured during childbirth here. These are the raw areas. You see that for most doctors have never seen them. What they've seen is this sort of representation on numbers 33, 32, and 38 and 8, where this pelvis has been preserved in formalin, and formalin destroys these autonomic nerves. So generations of doctors since the war haven't seen these the full morphology of these nerve plexi, and they are out of sight and out of mind, if you like. So I've called this antenatal allodynia, where a condition where a pain is caused by a stimulus that does not normally elicit pain. So normally a second and third pregnancy isn't painful, but when the weight of the pregnant uterus lies on the injured surfaces, then it causes this intense neuropathic pain, which is there either on one side or both sides of your pelvis, and persists until delivery takes place. I mean, usually the woman's begging to have an induction of her labor at 37 weeks gestation, as early as is possible. So that's this short summary of antenatal pain. I call it antenatal allodynia. It certainly isn't anything to do with the symphysis pubis for the most part, but it does cause a great deal of trouble for women, and it causes intense distress, which, although it doesn't register as a very serious antenatal problem, it really is. And it's very important the woman understands what it is, where it comes from, and what to do about it. She needs to understand that she can change her position during lie down on the opposite side is often the best thing to do. Take the weight off it as much as she can. Use whatever painkillers and anti-sickness drugs that that a doctor prescribes, and then arrange an early induction of labor at 37 weeks, because that's the only way that it gets better. If you have it in your second, it will recur in your third, fourth, and any subsequent pregnancies. Very difficult situation, needs to be improved.